An alarming number of children are being rushed to Rady Children's Hospital with an illness that stems from COVID-19. ABC 10 News reporter Rena Nakano explains the dangers of Miss C.
While the coronavirus pandemic dominates the headlines, pediatricians worldwide are seeing a spike in another dangerous trend.
We're just, in the midst of Miss C.
Miss C stands for multisystem inflammatory syndrome in children. It's an inflammatory reaction to COVID affecting mostly school-aged children who 2 to 6 weeks prior got COVID themselves or were exposed to someone with COVID-19 in the household. Symptoms include
vomiting, diarrhea, red eyes, red lips, a rash throughout the body.
Dr. Adriana Tremolay says since last April, there have been 57 cases of Miss C at Rady Children's Hospital, but a majority of them were seen in the last 2 months. Timing-wise, she says it aligns exactly 2 to 6 weeks after the holiday COVID spike in adults.
So the heart is a pump, and it doesn't pump well in many of these children.
Children spend on average 5 to 9 days at Rady, many needing care at the ICU. Dr. Tremolay says Miss C predominantly affects Latino and African American children, but it's unknown if it's because there's a larger COVID rate among these demographics or if it's a genetic predisposition.
Latin America is seeing a lot of Latino children, of course, with Miss C, but they're also seeing a lot of COVID, whereas countries in Asia have also, of course, seen less COVID, but they're really not seeing Miss C at all.
Dr. Tremolay asks parents if they had or were exposed to COVID in recent weeks to be extra vigilant.
Using that barometer as a parent where you know that your child is ill more than they normally would be and to seek medical attention.
Rena Nakano, ABC 10 News.
The youngest Miss C patient at Rady Children's Hospital was 2 years old, and the oldest was in their teens. But there have been some cases nationwide where Miss C presents itself in young adults.